This medication, Junel Tablet, is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Junel may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It is important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. The recommended daily dosage and optimal timing for taking Junel Tablet should be determined by your healthcare provider. When taking Junel Tablet, it's important to follow the directions carefully. You can take this medication by mouth once daily, at the same time each day. It's best to pick a time that's easy for you to remember. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow, following the manufacturer's directions for your specific brand. Make sure to continue taking this medication exactly as prescribed by your doctor. The amount of estrogen and progestin in each active tablet may vary at different times in the cycle, so it's important to follow the package instructions and take the pills in the correct order. If you experience vomiting or diarrhea, it can affect the effectiveness of the medication. In this case, you may need to use a backup birth control method. If you have stomach upset or nausea with the medication, taking it after your evening meal or at bedtime may help. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row, and if you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after the last active pill. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, consult your doctor for more details on how to start and when to use additional forms of non-hormonal birth control. Some common side effects of Junel Tablet include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles or feet, and changes in weight. You may also experience vaginal bleeding between periods or irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If you miss 2 periods in a row or 1 period due to improper pill usage, it's advisable to contact your doctor for a pregnancy test. It's essential to keep in mind that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. While many people do not experience serious side effects, it's important to monitor your blood pressure regularly and inform your doctor if it's high. Seek medical attention immediately if you experience serious side effects such as lumps in the breast, changes in mental health, severe stomach pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes or skin. Rare but serious side effects of Junel Tablet may include problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek immediate medical help if you experience symptoms such as chest or jaw pain, confusion, sudden dizziness or fainting, pain or swelling in the groin or calf, trouble speaking, sudden shortness of breath, unusual headaches, weakness on one side of the body, or vision problems. While a serious allergic reaction to this medication is rare, seek immediate medical help if you notice symptoms such as rash, itching or swelling of the face, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you smoke cigarettes or use tobacco and are over 35 years old, do not use Junel Tablet. Smoking raises the risk of stroke, heart attack, blood clots, and high blood pressure from hormonal birth control. The risk of these serious problems increases with age and with the number of cigarettes you smoke. Do not smoke or use tobacco. Before taking Junel Tablet, make sure to inform your doctor or pharmacist of any allergies you may have to estrogens or progestins. This medication may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. It's essential to share your medical history with your doctor or pharmacist before using Junel Tablet, especially if you have a history of blood clots, high blood pressure, cancer, diabetes, heart problems, or liver disease. If you have diabetes, it's important to monitor your blood sugar levels regularly while taking Junel Tablet and inform your doctor of any changes. Additionally, if you have diabetes, phenylketonuria, or any other condition that requires you to limit sugar or aspartame in your diet, caution is advised when taking the chewable tablets. Inform your doctor if you will be having surgery or if you'll be confined to a bed or chair for an extended period, as this may increase your risk of blood clots. While taking Junel Tablet, limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing, as this medication may cause skin darkening. If you wear contact lenses, be aware that you may experience vision problems while taking this medication. It's important to note that it may take longer for you to become pregnant after stopping birth control pills, so consult your doctor if you have any concerns about fertility. Junel Tablet should not be used during pregnancy, and if you become pregnant while taking this medication, be sure to inform your doctor immediately. Additionally, if you are breastfeeding, consult your doctor before continuing to breastfeed while taking Junel Tablet. It's important to be aware of potential drug interactions that could affect how Junel Tablet works in your body. This includes medications like aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain products used to treat chronic hepatitis C. Some drugs may also decrease the effectiveness of hormonal birth control, leading to a higher risk of pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new medication, it's important to talk to your doctor and discuss whether you need additional reliable birth control. Keep an eye out for any new spotting or breakthrough bleeding, as these could be signs that your birth control is not working as well as it should. Additionally, Junel Tablet may interfere with certain lab tests, so make sure to inform the lab personnel and your doctors that you are taking this medication. If someone has taken too much Junel Tablet and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek help immediately. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents should call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to note that you should not share Junel tablets with others. While taking this medication, it's essential to have regular complete physical exams that include lab and/or medical tests, such as blood pressure, breast exam, pelvic exam, and pap smear. It's crucial to follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose, refer to the product package for instructions. It's important to use backup birth control like condoms or spermicide to prevent pregnancy. If you have trouble remembering to take your pills, talk to your doctor about other birth control options. When it comes to storing Junel Tablet, it's important to keep it at room temperature, away from light and moisture. It's best to avoid storing it in the bathroom, and always make sure to keep it out of reach of children and pets. When it comes to disposing of Junel Tablet, it's important not to flush it down the toilet or pour it into a drain, unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure about how to do this, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.